We heard opinions varied as far to in one direction as why are you even talking about this? This is irrelevant. Doctors shouldn't be talking about these things, all the way to this is the single most important thing, for the future of healthcare in Canada on almost every one of these topics.
Back in late 2023, we told you about a public consultation period the Royal College of Physicians and Surgeons of Canada had opened, where Canadians could provide feedback on an effort to update something called the CanMEDS framework, a guide to how physician training curriculums will be built across the country. The Royal College had asked a group of scholars in medical education to do a review of recent medical literature around the world. About 18 months later, that group suggesting about a dozen emerging concepts to be considered in that update, including EDI and data-informed medicine, as well as newer terms like physician humanism and planetary health.
So we got about 10,000 responses through various different channels here at the Royal College, and spent about 3 to 4 months essentially analyzing what in many cases were pages and pages of people's thoughts on these topics.
But as Glenn Bandiera, Executive Director of Standards and Assessment at the Royal College, explains, while his team expected differing opinions, the sheer volume and potency of polar opposite viewpoints took them by surprise.
I think we were surprised by how quickly some of the issues became very divisive and started to be seen as not so much competencies that physicians need to have, but political points of view that people should adopt or shouldn't adopt.
How will you go about trying to find some broad common ground that at the very worst is begrudgingly acceptable to basically everybody or better?
Well, the process that we've used has been quite iterative in nature. The groups that wrote those white papers were called expert working groups, and we provided back to them all of the feedback that came from our public consultation that was relevant to their work, and asked them to revise their white paper and recommendations based on that feedback.
All that material will then go on to the CanMEDS Framework Development Committee. When a draft framework is complete, a second round of consultation will begin. Bandiera saying right now they've extended their timeline by about a year in the hopes of reconciling these differences, adding he's open to stretching it longer if needed.
We're willing to take whatever time it takes in order to get the framework right for this iteration.
Now, the full conversation I had with Glenn was much longer, and he shared a lot of useful and relevant information we thought you might find helpful. If you want to hear more, visit citynews.ca.